NIPP, or the No Incision Pain Procedure, is a percutaneously placed, microchip-controlled, pulsed neurotransmitter designed to relieve chronic or acute pain. It does this by providing a continuous flow of intermittent, low-frequency electrical pulses to specific peripheral nerves percutaneously placed in the ear. The device weighs only 7 grams and is placed behind the ear. Once installed, NIPP provides peripheral nerve stimulation for 4 consecutive days. Battery-powered and controlled by a microchip, NIPP is minimally invasive and is applied in an economical time frame. Recommended treatment consists of an initial assessment and placement session, with subsequent sessions dependent on physician assessment. The results of continuing use demonstrate that specific stimulation of peripheral nerve endings located in the auricular region not only relieve pain, but also seem to regulate secondary effects common in pain patients, such as anxiety, depression, and insomnia. The NIPP procedure has been effectively used to treat a number of chronic pain and emotional conditions. It is FDA cleared for the treatment of acute and chronic pain. These include, but are not limited to, back pain, cervical pain, arthritic and joint pain, fibromyalgia, zoster-related pain, cancer pain, post-op pain management, craniofacial pain, TMJ, depression, insomnia, migraines, neuropathic pain, sciatica, shingles, vascular insufficiency, wound care, and many more pain-related ailments. When you order NIPP, you will receive a multi-point stylus, a tube of adhesive gel, and the NIPP package. The package includes the NIPP device, a protective cap for the device, 3 sterile NIPP points, an alcohol prep pad, 3 oval adhesives to cover the NIPP points, Tegaderm adhesives to secure the device in leads, and a replacement cap for the stylus. Other optional items providers may find helpful when installing the NIPP device includes sterile tweezers or forceps, a thin point permanent marker, sterile cotton swabs, as well as additional alcohol prep pads and Tegaderm adhesives. The multi-point stylus is used to locate the peripheral nerve endings that are connected to the NIPP points. The stylus comes with a battery and a replacement cap. To place the battery, unscrew the rear plug so you can pull the protective shield from the stylus, place the battery in the compartment, and reassemble. Test the stylus by placing it against your fingertip. If you hear a pitch like this, the stylus is ready to go. The stylus tip should be sterilized between each device installation. To sterilize the tip, remove the plastic cap from the treatment end of the stylus and clean it with an alcohol prep pad. To prepare the NIPP device for installation, open the package and place the contents on a sterile surface within easy reach. Each package contains the following items: written instructions, the NIPP device and 3 batteries, the 3 NIPP titanium needles, a replacement cap for the multi-point stylus, and an alcohol prep pad, oval adhesives, as well as a Tegaderm adhesive. Next, remove the back of the package containing the titanium needles, but be careful not to dislodge them from their holder. You'll also need to record the device's serial number for billing and product tracking. This serial number appears on a sticker attached to the removable backing of the device. When you remove the backing, remove the serial number and attach it to the patient's chart. To activate the device, first remove the protective tabs covering the batteries, and then press all 3 batteries into place. Then attach the protective cover to the device. Make sure your skin is making contact with the back of the device. Touch the tip of the stylus to each of the 3 connecting rings. In addition to the pitch of the stylus, you should also hear the rhythmic ticking that indicates the device is active. Now, attach the connecting rings to the titanium NIPP needles. Sterile forceps or tweezers can be helpful with this step. Some additional finger pressure may be required to lock the electrodes in place. Before prepping the patient, be sure to follow standard hand washing procedures for treatment. Have the patient lay supine on the bed and turn their head to the side to allow full exposure to the lateral aspect of the neck and auricle where the device will be installed. Use an alcohol prep pad to clean the outer ear and mastoid area. These items clean and remove body oil that can prevent the device from adhering properly. You are now ready to use the multi-point stylus to locate the 3 peripheral nerves where the NIPP leads will be attached. The stylus is designed to locate peripheral nerve endings by emitting a pitch that indicates their electrical resistance. A low pitch, like this, indicates high electrical resistance that is not conducive to NIPP treatment. A higher frequency pitch, like this, indicates low resistance that will maximize the effectiveness of the treatment. Because of anatomical variations, you will need to move the multi-point stylus around the indicated area to find the best location for the NIPP points. When the stylus reaches its highest pitch, mark the location by pressing the back of the stylus to extend the tip. This will leave a slight indentation on the patient's skin. You may also use a marker to better identify the location for the NIPP point. Repeat this process for the 2 remaining stimulation points. To place the device, first apply a small amount of the adhesive gel to a sterile cotton swab and spread it gently on the area where the device will be placed. Remove the backing from the device and place the unit on the patient, holding it for 60 seconds, allowing the adhesive to dry. Now you can attach the NIPP leads to the peripheral nerve endings you marked earlier. Use the oval-shaped adhesives to secure each lead. Once all 3 points are properly placed, use Tegaderm adhesives to further secure the NIPP device and leads. At this point, the installation is finished, and the patient should be able to feel ticking from the device. While it may feel strong at first, the intensity of the ticking will decrease after a short time. The ticking will occur in 4-hour intervals throughout the duration of the treatment. Remind the patient to keep the treatment area dry and watch for any swelling or anomaly that could indicate an infection. Have the patient wait 15 to 30 minutes after the procedure to evaluate the immediate effects of the device. Ask the patient about their comfort, current level of pain, and any immediate symptom relief. If the patient is comfortable with a placement, have them schedule their next follow-up NIPP treatment. For more information on the NIPP procedure, please visit our website at www.fixpain.com.